Hey y'all, and welcome to my channel. On this page, I talk about technology and money and sometimes trending topics. If you're new here, welcome to the page. Please consider liking the video and sharing. Liking and sharing the video does two things. Number one, it helps this content get out into the algorithm. So if you're interested in what I talk about, others may be interested too as well. And number two, it encourages me to continue creating content that you all find interesting. And if you are coming back, welcome back. Today, I wanted to share a upcoming free seminar or discussion on the potential of artificial intelligence for nursing. I've done several videos about AI and healthcare, and also how artificial intelligence is currently changing and will continue to change how nursing is practiced, no matter where you work, whether you're working at the bedside, the operating room, in outpatient ambulatory areas. If you work in insurance companies at a startup, I work in technology operations, and I can tell you right now, artificial intelligence is changing the way I do my work. I've worked in tech as a registered nurse for 20 years. And as I've said before, I haven't seen a technology be so dynamic and change healthcare practice, especially nursing practice, so fast. It's moving fast, y'all. And I'm about to share the upcoming seminar. I will say, as a registered nurse working in tech, at this point, like over the summer, I took a data science class, a data science for nursing class. So I have a data science certificate. I also enrolled in a prompt engineering class that I will be a prompt engineering course that I will be taking. And right now, I just finished up a Microsoft Azure cloud, a cloud course, so I can get start getting my cloud certifications. I actually have my first cloud certification exam coming up next week, and then after that, I'll be taking another cloud class, and then also I have a prompt engineering certification that I'm working on as well. Y'all, I'm telling you, I haven't seen artificial intelligence is impacting and moving so fast in nursing. And even as an experienced nurse working in tech, I am upskilling. I am having to upskill because we have AI. That we are implementing AI with the technology company that I work at, and I'm seeing a lot of changes. So I want to share, I came across this upcoming, you can call it a seminar or a discussion. It is free. And I'm just sharing this. I'm just sharing this as a resource. As I come across resources, I like to share with you all, whether it's here or over on TikTok or Instagram or some of my other social media platforms. So next Monday, December 11, 2023, at 1 p.m. Central Time, 2 p.m. Eastern Time, there's going to be the potential of AI for nursing seminar or conversation. Is presented by Becker's. I've talked about Becker's Healthcare. I have talked about Becker's Healthcare on this channel several times before, but if you've never heard of Becker's to me, I mean, there are plenty of outlets where you can get healthcare technology news. I like Becker's because they have different newsletters that you can sign up for. You don't have to go to their website. You can sign up for different ones, like on healthcare technology finance. You can refine, the content that you receive. But that's how I get a lot of my healthcare technology news, in this one way that I stay on top of what's happening in healthcare technology beyond just artificial intelligence, because it's just moving so fast. So the description for this seminar says, as more hospitals and health systems innovate to augment staff, increase efficiency, and deliver higher quality care, leaders are carefully considering where and how technology will have the most impact, especially on the front lines. To me, that's like the bedside, like bedside nursing, okay? Or nurses who work like in peri-op areas or ambulatory. So on Monday, they're going to have two nurse leaders. One is from Duke University Health System, which is in North Carolina. And the other nurse leader is from Intermountain Health, which is in Salt Lake City, Utah, and also Nuance. And they will be doing a talk on the potential of artificial intelligence technology. Excuse me. They will be doing a talk on the potential of artificial intelligence driven technology for nursing. Okay. And so what you can do is, after this live wraps, I'm going to leave a link to this where you can just directly go to the link. So you're going to learn about how to thoughtfully implement AI for nursing and ways AI can augment the nursing workflow. So the two nurse leaders who are going to be talking about artificial intelligence for the potential of nursing, one is the Chief Nurse Informatics Officer. Her name is Kay Lytle. She's the nurse leader from Duke. If you don't know what a Chief Nurse Informatics Officer is, for those who are unfamiliar, a CNIO, or a Chief Nurse Informatics Officer, is a technology nurse leader. This is a nurse at the very highest level of healthcare technology, whether it's AI, whether it's any other type of technology. So that's what a CNIO is. So if you want to think of an equivalent, think of, if you've heard of what a CEO or a Chief Executive Officer is, or a CIO, a Chief Information Officer. CNIO is the equivalent of a CIO, but for nurses. Okay. And the other panelist, her name is Becky Fox. She's the Vice President and Chief Clinical Information Officer, and that's from the health system out in Utah. And the moderator is also a nurse. This AI on this AI potential for nursing seminar. She's also a nurse. She's the Senior Vice President and General Manager at Dragon Medical at Nuance, which is a Microsoft company. So if you're not familiar with what Dragon, well, first of all, Dragon is a dictation software. So it's a software that providers, nurse practitioners, physician assistants, doctors can use to dictate their clinical notes. So instead of a provider having to sit down and type out like notes and after visit summaries, they can just talk into like a smartphone or a microphone, and Dragon, the software, will automatically write their notes for them. But what Dragon and Nuance is doing is way more advanced than that. They are now integrating artificial intelligence to where the provider not only can just talk directly into a microphone, they can have listening devices, audio devices in the room with them. The provider can have a listening device in the room with themselves and the patient, and just have a natural conversation with the patient. And the AI will not only dictate the provider's notes, it's also more enhanced than that. And it also automatically documents in the patient record. So I'm very much interested in this seminar. So you go to the link, you can put in your information here. You can also sign up for additional newsletters. This is one, Health IT and CIO report, but they have more. But you can also, if you're unfamiliar with Becker's as a resource for learning opportunities, they're always having these type of seminars. They're always free. Okay, free. Well, nothing is free. It's free as in you give your time in exchange for not having to pay anything. I shouldn't say it's free. You do have to pay in time. So it's an hour, right? But you can sign up for other webinars or seminars that they have. You see they're doing one on December 14th on AI automation versus human interaction and patient engagement. Here's one for physicians doing around re-imaging the surgical gown. So maybe if there are any perioperative nurses that come across this content here on YouTube or TikTok or another platform, you may want to sign up for that webinar. They talk about virtual care and being able to use that in the inpatient behavioral health setting. Virtual nursing is one of those nursing specialties that has exploded. I've talked about virtual nursing a little bit on this channel before, but that's another specialty. Virtual nurses, virtual nursing, just like you have bedside nurses, CTICU nurses, etc. And they also have other ones. So yeah, y'all, that's it. I just wanted to share this resource with you all, the potential of AI for nursing, for those nurses or those who are interested if you don't work in tech or nursing informatics, clinical informatics, healthcare informatics, but you're interested in starting to pivot your nursing specialty in that direction, this is yet another resource. I love sharing resources with you all because people share them with me. So as I learn, I'm definitely liking to share that with you all. Once I complete my certification for my first cloud certification that I'm taking, I may do a little review on it. We'll see. I got my data science certificate. I finished that course. It was actually presented by Emory Nursing. So Emory Healthcare in Atlanta, Georgia. Their School of Nursing has a data science certificate specifically geared towards nurses who want to go into data science. So we do have a comment. Thank you for the comment. I'm currently getting my bachelor's degree in information technology and planning on going back to school for an accelerated nursing degree. Congratulations. That is awesome. That is awesome. So with your bachelor's in IT and then you have your nursing degree, that's definitely having those degrees will definitely give you an edge if you decide to go in informatics of any kind. If you don't mind sharing, if you have any interest in technology, what you're interested in, like are you interested in cloud operations, maybe being some type of epic builder or like a coder, etc. I would definitely love to. So you did. Okay. You let me know. You said, yeah, you're thinking about going in healthcare tech. I definitely think it would work having your bachelor's in IT as well as the nursing degree. It will give you an edge. It would having those degrees definitely would give you an edge. And check out some of the other videos on my channel. I've shared other resources out there as well. So yeah, congratulations to you. Definitely wishing you well on your journey. Okay, y'all, I'll leave a link to this seminar in the comments once this live is over. I really hope everyone is doing well and I hope you have a good weekend. Okay, and I'll see you in the next video.